And we're live. It's Dr. Kris and the Peptides and Age Management weekly. We're trying to do this weekly, Dr. Kris. You all of a sudden you've gotten really popular and you're having to go off and speak at all these conferences. How you doing?
I'm good, really good. It's been a catch-up week. We were in Nashville last week, mainly fun actually in Nashville. A little bit of work that we'll make an announcement on that in a month or so. But just glad to be back, glad to be catching up, glad to be talking with you today.
Awesome. So, do you mind kind of giving us a little bit of a review? A while back we worked on. You did a presentation on um, your presentation that you did on Alzheimer's, right?
Yes.
Okay. And then since then, also, you've been on Dr. Seed's podcast as well. So, can you give us a little update?
Yeah, so in between there, we went out to LA and recorded the lecture on bioidentical hormone replacement via pellets or subcutaneous therapy. I believe that module through SSRP, which is multiple experts in hormones that are recorded their different lectures together out there in LA. I believe that's going to be coming out in about a month. So that'll be something people can be looking for. And then last week, which it hasn't been released yet, but we did Dr. Seed's podcast, Sex, Drugs, and Epigenomics. That should be, I would expect, to be coming out in about a week. I do think they edit it just a little bit and then they release it whenever they're ready to let that out. And then we still have on the books right now to lecture at the uh, uh, World Peptide Congress, which is September 10th and 11th out in Las Vegas at the Four Seasons.
All right, exciting. So this is excellent. So I want to remind everybody that first of all, these conversations are intended as educational, and always consult your physician before changing your medical program. So today on Peptides and Age Management with Dr. Kris, we're going to talk about injectables. Now, injectables can mean a lot of things. So let's start off with these are mainly what you guys do are cosmetic injectables, no?
Yeah, I think the purpose of today's topic was just kind of talking about some of the different things that men and women can do to improve their aesthetic health, maybe take a few years of age off of themselves. I think as we all age, we start possibly looking at different ways to slow down that aging process. It's kind of what we do in general. We're always looking for ways to slow the aging. We can't stop it, but we like to try to slow it the best we can. We like to, when we're 50, look maybe 40, 45, not be 50 and look 60, 65. And one of those ways in our practice and many practices that we use to help with the aesthetic side are our injectable products. And that can be a wide ranging topic. You know, everybody's heard of Botox. I don't think there's any adult out there in America that has not at least heard the word Botox. They may not have a good idea of what it is, but there's Botox, and and that's a muscle paralyzer. So we generally will use those in areas. I like to say, for the most part, and don't this isn't concrete, but we typically use Botox from the cheeks up, and then we use fillers from the cheeks down. And it's just depending on what the goals of the patients are.
So when we think about these injectables are we're wanting to address our appearance. And so there are several ways. There's the internal, you can come in from the internal perspective, so to speak, with
Mhm.
diet, exercise, things like this. Next, you could think of the topical. What can I rub on? How should I clean? And
Mhm.
then the injectables would be a third way. So, can you kind of give us just a brief little rundown on those three strategies of how to impact your overall looks?
So I'll just go back to a consult that I did. I believe it was last week before we went to Nashville. My time runs together. And it was a young lady that came in and she was having a big event. I believe there was a wedding in her life that was coming, probably a daughter or a son, from what I remember. And she wanted in the next 4 to 6 weeks to figure out what she could do to improve her overall appearance for this event. And certainly we did get some options that we'll kind of go to in a second, but like I told her, and because I always try to be very honest with my patients, I would have liked for her to have came in 10 years prior. She was like 59, and I don't mean anything bad about it. And I used it to basically talk to her about what we need to do from this point on. Because I always tell my patients we can't go in reverse, but we can pick up and go forward. And she was, I think, about 59. She had been menopausal for about 10 years and had not treated her hormones ever. And unfortunately, that's the biggest thing that causes my patients to age is sun and hormonal imbalance. The one thing that we try to, like, with our own kids and with any of our young patients in that 18 to 25 to early 30s is protect the skin. That's the first thing that you can do. Don't go out and get a sunburn every weekend and think that it's cool and not expect that not have severe damage down the road. One of the things Texas did as a state, I believe it was 5, 6 years ago, that I think was one of the best things they could have done, is they made tanning bed illegal for teenagers under the age of 18, to where the only way that they can't legally do it. Now, don't get me wrong, some people have tanning beds at home, and that's hard to stop. But your tanning businesses can no longer do that. And I think that's really good, because you're not allowing those kids at 13, 14, 15 years old to incur all of this damage before they even get to 18. So the sun is so important. As we age and we get around our age, like you and I, Steve, and they get around 50, making sure the hormones are right, especially in the ladies, when they lose their estrogen, their collagen depletion just skyrockets. That's why the skin starts to get saggy and stretchy and wrinkles and lines. It's a combination of those hormonal imbalance and sun damage. And then some of it's genetics. There's some people that just have great genetics, and that we can't change at the moment. So then you start getting into, so I started talking to her about, okay, well, obviously that's not going to help in 6 weeks, but we really need to get you in here, get your labs drawn, get your hormones looked at, get those fixed so that we can slow down the progression of your collagen elasticity. But in the meantime, let's look at some topicals. And that's where we use the topical peptides, mainly the GHKCU, the copper peptide. Now, again, that one's probably not going to help her a lot in 4 to 6 weeks. That one's really a 60 to 90 day process. What are we trying to do with it? We're trying to increase the collagen elasticity. GHKCU has been shown to improve collagen elasticity up to 70% in 3 to 6 months, and to decrease lines and wrinkles depth by around 35 to 40%. So that's a great thing we can do in combination with the hormonal balance. And then actually I would throw in one in the middle, and that is one of the simplest things patients can do is proper skin hydration, which is the hydrofacial, which is a very non-invasive procedure that a lot of my patients take advantage of on a monthly basis. They come in, they get a 30, 40-minute procedure, hydrates the skin, takes off all the dead skin that we're constantly losing. It's an immediate response. These patients, I've never had a patient leave after a hydrofacial and not believe that they were better than when they came in. And so that's very important. Proper skincare regimens is really important. I'm a typical guy. I don't use probably as many products as I should, but I do use 3 or 4 things, and just using the proper facial wash along with a moisturizer and a sun blocking, product. Sunscreen, thank you, is so important. And then that's when we get to the injectables. And that's why she was really here, was the injectables. But I just wanted to make sure that she understood that it's just not as simple as, hey, come in, throw some Botox in me and leave. It can be that simple, but most of my patients are looking for more long-term solutions. And as I tell them, a lot of times I would rather them spend a little bit monthly than a whole lot once a year, because they'll get better results if they use the proper skincare, do a hydrofacial, every now and then do some fillers and Botox, versus some of my patients every 3 months, they come in and they get these different products, and that's fine too. It's to what the patient's really looking for.
When I'm listening to you talk, and I'm in marketing and we have an agency, and folks approach us, and we have a version of Botox where it's like, hey, I want my facelift on my online marketing, right? Can you do
Right.
some SEO? And it's the same concept. It's the same universal principle. Let's make sure we have all our fundamentals healthy
Mm-hmm.
as well, or this
Right.
is going to be a big waste of time. And So when we think about injectables and hormones, the first thing that we are thinking is the Botox. But what are some of the other things that you would consider?
So, in our office, at least, we're an all Allergan clinic, and Allergan is the maker of Botox. They're the owner of Cool Sculpting. Their injectable line is the Juvederm Ultra Plus, Volbella, Voluma, and Velour. That's their product line. I would equate that to like Mercedes Benz, and Mercedes Benz has C class, E class, S class. And certainly there's other lines of fillers. When you get in those other lines of fillers, it's like, okay, here's a Chevy, here's a Ford, here's a Nissan. They all have their different products that do similar things. I've always been an Allergan fan because, again, you say Botox and Juvederm, the average female will at least know what you're talking about because they are the leaders of the market. There are alternative products out there. I don't believe they're better. I think they're can be at best comparable. I've just always chose to stick with what I believe to be the best products. It's easier on me because I don't have to try and learn, okay, here's four different products that really do the same thing and trying to figure out the slight differences between them. And when I did used to have different products in my practice, I just found it got really complicated. Most of the time, the patients would only choose the filler based off of cost.
Mm.
They would say, "Oh, well, this one is $40 cheaper," because there's competitors also to Botox. But generally, they don't work quite as good, at least in my experience. And so, it's actually kind of what we did with our hormone program. Like we made our hormone programs cost the same because I want to take the financial aspect of the decision out. And I'm sure in what you do, many times the customer wants to go for, hey, I'll take that cheapest route. That's probably the best when it's probably not the best. Spend a little more and you get better results and you're happier overall. So in our office, we're Allergan only, but but all injectables aren't the same. And so most of my clients, when they come in, don't really have an understanding unless they've really been doing this for a while of what filler does what. And I think that's one of the things that's really important, no matter who's listening to this and what injector they choose to inject them, is making sure that injector, and that can be difficult. Like, how do you make sure your injector is qualified to do your injections? I think looking at before and after pictures is really a good thing, and making sure that they at least acknowledge to you that that's their before and afters, not the maker of the products, because a lot of times that's what people do. They use the before and afters from the product itself. It doesn't hurt to actually. Most of my patients, luckily, I think they come here because they've seen someone else who's come here. So I think it always feels good if your friend went to a place and had a really good outcome, and maybe they've been going there a while. That'll make you feel better. I think it helps that they know we've been doing this over 10 years. We've been here for a long time. We're not going anywhere. I'm always leery of like the Botox and filler parties. I think you need to be really careful with that kind of stuff. Many times that can be injectors that are just starting and they're looking to make a few bucks, and they go and do these big parties, and everybody in the room kind of gets the same thing. Because that's one thing I would tell you about fillers is no two patients are exactly the same when it comes to fillers. So many times somebody comes in and says, well, my friend Stephanie got this and she got Voluma in her cheeks. I want Voluma in my cheeks. Well, maybe you're a candidate, maybe you're not. That's why when our patients come in, we take pictures, we look at the patient, I kind of make my own judgment of what I think they would be best suited to do. And then I say, what are you wanting to work on? So that I can see if what they see is what I see. Because as I tell my patients, no one stares at your own face more than yourself. And I want to know what's bothering them. And then, sometimes, just like I had a patient yesterday, I say, I don't really think I can correct that. That's more plastic surgery. That's not what we do here. Because I'd rather not treat a patient than to just take their money, do a service that I know they're not going to be happy with in a month. It just creates hard feelings. I mean, I've certainly gotten to cases where I thought I could maybe do it, and I treat them and it's like no one's really happy at the end. I try to avoid that. even have an inkling that I don't think it's going to work, then I just won't do it. I'll just say, I don't think your money's going to be well spent doing this procedure.
So when we say injectables, I'm sure that the folks that are listening, they have something that comes to their mind, and what comes to your mind are could be very different, especially all the right questions to ask. So tell us about injectables. How do they work, and what are the right questions we should be asking?
So when I say an injectable, I mean anything that I'm actually injecting into the skin of the face. The most common one again is Botox, and we're going to inject that. That's a really easy procedure. Doesn't cause minimal to no discomfort. When Botox is done by an experienced provider, has very limited chance of any major side effects. Probably the biggest one is what we call eyelid drop. Knock on wood, I've never had one of those in my practice because we use good, consistent technique. We only use quality products. The one thing about like your different injectables too, and unfortunately, I don't think the consumer has a way to know this. Some people can get these things through illegal means, or they don't mix them properly. They kind of dilute them too much to keep the cost down. And unfortunately, as a consumer, I hate to say this, I don't know that you have any way of knowing that other than making sure you're just using reputable places. The other thing is there's a fairly consistent margin that these products cost and what people charge for them. And if someone is charging like a significantly less amount than everyone else, that's a red flag that something's not right. Because these products aren't cheap. The profit margins aren't what people think they are. And when I'll sometimes see people advertising Botox for cheaper than actually what it cost. And it's like, how's that even possible? Either that or that's a world's worst business plan to lose money on the procedure. And then, but most commonly, when people say injectables, what they're really meaning is fillers. Because most of the time, I find when they say injectables, they're not thinking Botox, they're thinking fillers. So, what is a filler? Most fillers, at least, and the ones that we use are hyaluronic acid based. Hyaluronic acid is basically the base structure of connective tissue, like cartilage. And so, that's what most of these products are in raw form. And we have different injectables that we use in different areas of the face. So, like on the cheeks, that's typically a Voluma product. Mouth or lips, that's typically Juvederm Ultra. Nasolabial folds, which are these big lines, down by our nose, typically that's Juvederm Ultra Plus. And then the Velour Volbella is kind of an in-between product that we use to fill lines and wrinkles with. I like to call it more airbrushing. And so everybody's different, but typically when we're saying injectables, that's what the patient is thinking about, is something that is going to fill a space, because as we age, that collagen gets weaker, and we lose some of that fat in our face too. And we get these increased lines and wrinkles. And so that's basically all we're doing with fillers is we're going in there. I like to call it a rudimentary term that I use with my patients is it's under the skin caulking. We're basically going under the skin. We're filling a space with a safe filler. These have been around for a really long time. We know they're safe. They're temporary. They're not going to stay around forever. They can be reversed somewhat. Luckily, I haven't never had to do that, but sometimes patients are like, what if something goes horribly wrong? Well, there's agents we can use to reverse that. Not something we've ever had to do in our office.
So where is this filler made? Is it made at a compounding pharmacy?
That's a good question. It's made by the manufacturer, and they do make it in a pharmacy. I think that would be equivalent to a compounding pharmacy. These are branded, pre-made products from big pharma, and so it's going to be their version of where like a diabetic medicine that's branded is made. It's going to go through the same criteria as those. So that the consistency and quality is there just because it is a branded product.
So what are the trends? I mean, are you seeing more and more people using them because maybe the population's aging, or men getting into this? What do you tell us some of the trends?
Yeah, so our population, I would first say that trends are going to be different based on the area of United States that you're in. Obviously, if we went to Beverly Hills, Boca Raton, Miami, you're going to see a lot different trends than Weatherford, Texas. At least that's my thought. And so my patients have a tendency to be a little bit more on the conservative side. So, like, just for example, we're constantly getting, I say constantly, actually, it kind of stopped during the pandemic, but normally we're having, because I always believe that we can learn more. And Allergan is really good to us, and they generally bring in trainers every 6 months or so to maybe train us on some different techniques or something they're doing and that is working. And like a little over a year ago, we had a trainer in here from Orlando, and he said, how many tubes per patient per visit do you normally use? And I said, well, probably 1 to 2. And he goes, oh my gosh. And in Orlando, we're 3.5 to 5 tubes of filler per visit. And I'm like, wow, you know, so there, somebody in like Orlando, Miami, Florida, they're looking for this really big change. They want people to see it and go, wow, you did something. Whereas in my area, I truly believe this. They want people to know that they look better, but they don't want them to know that they did anything.
Yeah.
And so here we go more with the theory of let's do a tube or two. Let's see how you look. If in a month, 6 weeks, we want to do a little bit more, let's do it. As far as men and women, absolutely men get this too. I would say probably in our practice, it is a female predominant practice, but I would say it's about 70-30. Now, Botox is much more close to 50-50. I would still say it's probably 60-40, but I've been getting Botox myself for well over 10 years. It takes a lot of age off of me. I look totally different without my Botox. My staff will come up to me and say, you're on the schedule day for Botox because I guess it's wearing off and I haven't paid attention. So Botox, I really think, a lot of people call it Brotox. I think Botox is so widely accepted that there's not a lot of stigma with men versus women with that. With the fillers, it's going to be a much more female predominant. At least in my area of Texas, mainly guys are coming in to get their nasal labials filled. That's where they like to do it mainly. Just to kind of freshen up just a little bit. But we're seeing more and more men in our practice getting hydrofacials on a monthly basis, actually buying skincare. Like, you know what? That makes sense. I should be using something just because my wife does it. I should be able to do it too. And so that's been a really growing population. Our practice has been the men, but more on the hydrofacial, Botox, skincare line side of things.
Yeah. So, I've had the treatment for my acne scars where they went in and they heated up what's the collagen?
Probably, maybe even IPL, intensified pulse light.
Mm.
You can do radio frequency or intensified pulse light. Those are procedures we do in the office as well.
So is there an injectable for bad acne scars?
Mm-hmm. Yeah, there's one in particular called Belafil that is actually FDA approved for filling those acne scars. So FDA approval is something that we always need to make our patients aware of. But many times, a lot of providers will be using these products off FDA label, which just simply means the company did not study that particular thing. But we know that if it's a filler and it fills things, that obviously we can use these different fillers to fill like acne scars. It just happens to be that Belafil went and did the study and got the actual FDA approval. So anytime that I am even considering going off label within the injectables, we make sure the patient knows that we're doing that. We get their consent to do that and make sure that they understand why we're doing that. And kind of going back to a question you asked me before, the biggest thing is making sure that I'm treating what the patient wants treated if I believe it's treatable. In other words, the patient, like I may look at you and say, okay, I think you need this, this, and this. And you may go, that doesn't bother me at all. This is what bothers me. And that's important because that's great if I look at you and go, I think you look so much better, Steve. But if the patient still is looking in the mirror and still sees the same problem that they came in for, they're not going to be that happy. But then also making sure that we give patients realistic expectations. Sometimes patients come in, and they think that somehow we can reverse their aging 15 years in one setting, and they don't care what it costs, but they better get the results that they're looking for. And again, that's where I always try to give my patients realistic expectations, tell them actually set out a plan like, hey, this is going to maybe take a year. It's no different if somebody comes in and says, I want to lose 30 pounds. I know, but I know damn good and well that I'm not going to get 30 pounds off of them in a month unless something bad goes wrong. So I need to make sure that they understand, hey, we can get the 30 pounds off of you, but it's going to take 6 to 12 months. And if they're not willing to commit to that, then there's no reason to do it. It's exactly how I look at aesthetics. If I say you need to do these 8 things and it's going to take this long, and if they say I can't do that, then you're better to just walk away from each other at that point and let them go to somebody else who's going to do what they want. Just like what you would do in marketing, like, well, I know that's not going to work, so why waste my time and your money, and you end up unhappy and writing reviews against me out on the internet. Let's do this the right way. The good news is most patients are very reasonable, at least in my neck of the woods. And if you can really just explain to them what you're trying to do, that's why we really try to take 30 minutes with our new aesthetic consults. And sometimes they're here for an hour, hour and a half with different people in my office. But I want them to really understand what we're trying to do, because they got to buy into it. If they just don't, so many people today, and I don't mean this badly, but it's just the truth, they're provider hopping. They're coming into you to see what you say and what you can do. And as soon as they don't like that, they're going to go to the next person, the next person, the next person. Those just aren't the clients that I'm looking for. I want somebody that's going to commit to me, just like you and I commit to each other with what we're doing, so that we can see the results. I mean, first time we talked, maybe first or second time, you told me this is going to take 12 to 18 months. It's not going to be 2 or 3 months. And, I had to be okay with that. And guess what? It took about 12 to 18 months. And so you just have to give patients realistic expectations. It's actually it's part of my lecture that I'm doing in September on erectile dysfunction. I just feel like if you start out with realistic expectations with every patient, no matter what it's for, weight loss, fitness goals, aesthetic medicine, reasonable goals, don't promise things that you know damn good and well you can't back up.
Yeah. So when we talk about these things, we're thinking about the hormones, we're thinking about these injectables. What peptides are for your skin, and would some of those be injectables? They're not probably typically considered when you say injectables, but they
Right.
should be considered.
Yeah. Well, I mean, it's so proper wellness all goes together. As I try to tell my patients, let's say I get a patient in and they certainly want to look better, but maybe that's not their primary focus. Their primary focus, they just want to get healthier. Just improving your growth hormone levels will help with collagen elasticity, will help with just wellness of your skin overall, skin, hair, nails. Heck, sometimes just fixing your thyroid helps a little bit if they've got a low thyroid. These are all little small things that we can do to help fix these things. So, peptide wise, I always tell my patients who are willing to try like a growth hormone secretagogue, is one of the things I say is that yes, it can help the skin. Is it going to take 10 years off your skin? No, it's probably not. But do I believe in 6 months or so your skin will look a little better? Yeah, I do. GHKCU can be used injectable. That's another thing that sometimes can be used. So I mean, there's really how I would look at aesthetics with injectable peptides wouldn't be so much I'm doing this specifically for your skin, as I would basically be saying, if I can improve your overall wellness, we know that the skin's going to improve along with it. And skin is one of those things that the best thing we can do for skin is never let it get into bad shape. Which is obvious, I think. Obviously, like it would be better if we never gained 50 pounds because it'd be way better. And maybe we could have done that if we'd have caught that person before their hormones got out of whack and kept them feeling good and kept them active, and they just never experienced those problems. It's actually one of the things you hear me harp on all the time: bone loss. The best thing I can do for my ladies is just make sure that they never lose too much bone and become osteoporotic, because treating osteoporosis, sure, hormones treat it, peptides treat it, but I'd rather not ever treat it. I'd like to just prevent it. That's the best way to go about it. But obviously, I'm going to have patients that are going to walk in and they're already in that scenario. But it is the reason why we're we do kind of harp on our patients about protecting the skin, preserving the skin, staying well, keeping your hormones right, eating healthy. Don't eat cheeseburgers all day. These things we can all do to help our skin. Anytime I see these like mid 20-year-old people and they come in and they look like what was that guy's name? Like George Hamilton. I don't know if you remember him.
I
You know,
do.
it always had that really dark tan. I'm like, oh my God, yes, you look good at 25, but you're not going to look good at 35, 40. Lay off the sun just a little bit. Certainly melanotan, that's a peptide that we can use to induce that tan, but also help a little bit with the overall skin quality and health. That's kind of a double whammy because not only are we kind of helping the skin with the melanotan too, but we're keeping them out of the sun, hopefully, because they have the tan that they want.
Mhm.
So that keeps them from feeling the need to go out there and get those bad UV rays. It's something I try to do a couple of times a year as well. And so that's just some of the kind of a thumbnail sketch of kind of how I look at peptides with the skin.
And what about water? People need to be hydrated. And by the way, I wanted to say I got that hydrofacial
Mhm.
and it felt awesome. But what was embarrassing was how much junk they got off my face.
And let's let a little secret out. The staff, all staff loves to show when they get somebody that has a bunch of stuff. After you leave, they go parading it around the office and say, "Look what Steve had in his face." It's funny when they get one that's like really bad, especially somebody that's either never had a hydrofacial or maybe they only get one once a year. I mean, if you want to be sold on a hydrofacial, just look at what comes out of your skin after a hydrofacial. And they love extracting white heads and black heads and all that stuff. I mean, it takes a select group to do that kind of stuff. But yeah, that's again, I always say hydrofacialism is something that nearly if you're anywhere in a fairly metropolitan area, you will find multiple people that have a hydrofacial machine. Just in my little community, there's probably 3 or 4. And the reason is because it really is the best. There just is an alternative that's even close to it. So I always tell patients, hydrofacial is a great thing. There is a little bit to the technician, but overall, most hydrofacials are really good. And if somebody just wanted to commit, you know, a little over $100 a month to their skin, and that's all they're willing to do, a hydrofacial is a great way to go about it. Actually, hydrofacial and good quality skincare goes a long way in preserving the skin.
Yeah. So, all right. So, water. If
Oh,
we're
water, yeah.
dehydrated,
Uh-huh.
how does that impact our facial look?
Well, and so water affects everything. And if we're dehydrated, which is a great point, 75% of Americans walk around dehydrated all the time. I can tell you right now, as I'm talking to you, I'm a little bit dehydrated. I can just tell by the dryness in my mouth. Um, so it affects so many things. It affects our metabolism. It affects our energy levels. It affects our skin quality. Nothing looks good dehydrated. You know, think of a piece of meat that you throw in the dehydrator and what it looked like before and after. And obviously, that's an exaggerated example, but that is kind of what's happening with the skin. The skin's just going to be more drawn up. The spaces are going to be more exaggerated because you don't have that fluid in the skin. Just always remember if you pee and it doesn't look like just pure clear, you're dehydrated. And by the time you feel dehydration enough that your mouth feels dry, you're significantly dehydrated. And like I say, I have to admit that I'm not as good as I should be on drinking water. It's one of those things that I try to, but I get busy and I forget. So hydration is just really, really important for all of us.
It's amazing how much more we have to talk about this than you expected from before we started. You mentioned, I don't know what else to talk about, but
Yeah,
there's a
right.
lot of questions. What is like the weirdest question you've gotten around injectables?
Huh. Weirdest question that I've gotten asked about injectables. I really can't think of one in particular. I think what always perplexes me is how patients believe that one injectable treats everything. And they're like, and they'll come in and I hate to say this, but they'll have that friend that looks great, has great genetics, has taken care of her skin, or he's taking care of his skin, and they're 45 and they look 30 and they say, I need you to make me look exactly like Becky. And it's like, you don't have any idea what Becky spends to keep looking like Becky. And then there's just a piece of that is just genetics that you can't get past. So that's probably like the most common frustrating thing that we deal with is somebody who has that friend that, has done everything right, and then they have not, and they want you to reverse the clock that much. So we can help pretty much anybody. Although I'm not afraid. Sometimes I tell patients, look, these fillers are going to be like $6,000. That's how much you need. And really and truly, that would be maybe a better down payment on plastic surgery if you're really, really wanting to fix this. Because I'm not anti-plastic surgery. It's just plastic surgery is not for everyone.
So the last two questions I have is like BP 157, even though you take it, like if you take it orally, it's to heal your digestive system, but it impacts your skin health and your healing, no?
Yeah, it fixes ligaments and tendons, I don't know that I would try to. Again, I'd go back to the wellness aspect,
Mhm.
and it's certainly in my regimen of wellness. I love BPC. It's probably a top 3 peptide. I keep saying I figured out that, like, I say that I have about 5 peptides that are my top 3 peptides. So I'm going to have to actually figure out one day what my top 3 peptides really are, because I remember one time Dr. Seeds asking the whole class, and he went one by one, like, what's your favorite 2 or 3 peptides? And it's so hard to choose, but BPC is just so well tolerated. Again, it hits the gut, it hits the brain, it hits the musculoskeletal system. If a patient were to ask me, do I think it's going to help my skin a little bit? Yeah, probably a little bit. I don't know that that would be, again, the one I would go to. I would go more for the topical GHKCU, which the nice thing about that is now is we have that over the counter. And so something that was prescription, just like BPC oral, something that was prescription only a year and a half ago, a year ago, is now over the counter and much less expensive. So I can literally have patients that, say, and we have it under the name Luminate, is the GHKCU topical. And so if someone says, hey, can you just ship me some Luminate? We certainly can do that because we don't have to establish them as a patient for that, since since it's over the counter now. And we actually have incorporated Luminate, or GHKCU topical, into our skincare regimen. So when our patients come in, each regimen is different based on your skin type and your goals. But our primary skincare line that we use is Zeo, but we always try to mix in the Luminate as well with the Zeo line.
And then last is like, where would ketone esters fit in with your skin health?
Well, I'd go back to that same loop of wellness. And again, I probably wouldn't sell it as the skin improving area of wellness. But again, the better we feel, the better we do. I mean, there is something that somebody that is mentally and physically feeling good that automatically aesthetically makes them look better. And I really, really mean that. You can have the most beautiful person on earth, but if they're depressed and not feeling well, it shows in their face. I have a handful of patients that I always say I can tell exactly how they're feeling by as soon as I walk into the room because of just how they look aesthetically. And so, we love ketone esters. It's such a great fuel for the cells. Healthier cells do ultimately lead to healthier skin, just healthier everything.
All right. So this has been an excellent, what I love about these conversations, Dr. Kris, is like you wished you could ask your doctor all the questions that come to your mind, but they never have time. And that's what I get to do. I get to just ask you all sorts of stupid questions, and you have to sit here and focus and answer, and everyone gets to learn.
I love it. You do throw me curveballs sometimes, but I like that. So, and I think it's important that the people listening know that none of this is scripted. We just kind of talk, and so that's what I like about it.
Yeah. So this is one of my favorite shows, Peptides and Age Management with Dr. Kris. Dr. Kris's clinic is a research clinic, and you can learn more at theresearchclinic.com. Reach out if you're a physician, and there are ways that you want to kind of break into maybe doing injectables, or maybe you want to do peptides. Reach out to Dr. Kris. He loves supporting you. And if you'd like to know more, then this is the place to go to get your skincare, to get your peptides, to all sorts of things. So, Dr. Kris, any last words?
No, I was just going to say, just to follow up on that, we're actually doing more and more physician consults on just helping them with their own practices. I actually have a phone call as soon as we get done here in about 30 minutes. I have a phone call with a doctor in California. It's been really fun trying to help other doctors in this who have similar mindsets, help with their practices. And then two, it's just on the business side of things with aesthetics. We never charge for consultations for aesthetics. We're not a high, I do not believe in the high sales, pushy consults. I just don't believe in that. I always tell my patients when the consult's over, if we believe we can help them, they have 3 or 4 options. They can leave, go home, call us back. They can tell us no thanks, but we'll stay friends. They can tell us, yeah, let's get going and let's start. We never try to push our patients because I don't personally like that type of sales, and that's not what we're ever going to do with our patients.
All right. Well, this has been an excellent episode of Peptides and Age Management with Dr. Kris. Stay tuned. Be sure to visit theresearchclinic.com and send us your questions. If there are some questions that you wished I was asking, I'd love to know so that I can ask the doctor on your behalf. All right, Dr. Kris, I want you to have a great week and a weekend, and I look forward to our next episode.
Thank you, sir.
All right, and that's a wrap.